she asked me in a comment section that if a resident complained about you that you didn't take care of their grandparents, what would you do in that scenario? So you are a nurse, I believe, or a healthcare support worker. So and a resident or relative of patient complained that you are not looking after you are not looking after their grandparents, what are you going to do in that scenario? So all right. If you haven't met me before, this is Saima. I'm a nurse from Southeast England. I provide information about UK nursing, how to become a nurse here in the UK, visa immigration, visa updates, immigration updates, jobs, each and everything you can think of, NOET, right? So if you haven't subscribed, what are you waiting for? If you are a returning viewer, thank you so much for coming back. Right, let's dive into the video without any further delay. You are a nurse on duty and a relative comes to you and say, see nurse, you are not looking after my grandmom. What are you going to do? So your first response would be just listen to the relative, what are they saying, okay, and then ask them, can you please tell me a bit more? Why do you say that? What's wrong? Can you please tell me? And when they tell you the whole story, they will also highlight what is their concern and why they are saying that. All right, when you get all the details and you are at the point where you felt like you're feeling like they are saying that they're not happy with the treatment or they're not happy with the care you're giving them, or you're not looking after their parents, then what you can do is you can just try to explain that I am a nurse here and I have 10 patients. I'm trying my very best to attend each one of them, and we try our best to provide best possible care that we can do. And I mean, in the beginning you can just try to you can try to be your own advocate, try to tell them that you are doing your best, and the NHS is very busy, we are always short staff, we don't get enough staff. When we don't get positive feedback, when we get like negative response from the relatives, we try our best to look after our patients. And for one nurse usually we get 10 or 12 patients. The number ratio between nurse and patient, like 1:12, it's really bad. I mean, one nurse to look after 12 patients can be quite tricky. And to be honest, let me tell you that here the patients, most of them are dependent on nurses for their feeds, for their personal hygienic care, for their mobility, and for their other stuff also. So as a nurse, for one nurse 12 patients doing their all things, all day-to-day activities of daily living, they cannot do much for themselves. So you as a nurse will help them with each and everything. So if I think about it, it's quite difficult. Sometimes it is difficult to manage, and dependency on the staff, patient dependency on the staff nurses is really high. I mean, if I get 12 patients, maybe 10 of them would be dependent on me for feeding, for personal hygienic care, or to take them to the toilet, or to take them for a walk. So basically what I'm trying to say is NHS is very short of staff, nurses are very less in the trust, and for 12 patients one nurse we usually get, or 10 patients for one nurse, it is very difficult to manage, it's difficult to handle, but not impossible. And what we can do is we can try our best and try to document. Most of the time we as nurses, if you are very busy, you don't get enough time to write your notes, you don't get enough time to document anything. But I would suggest you to do documentation if you see two patients, make sure you document for them first before going to the third person. What I like to do is I take my computer with me, I take my laptop, my work computer with me. If I'm going to one patient to go and give them medicines, I will take the work computer with me. I will document it there, what tablet I've given, what tablet I've skipped, or why I have skipped. I will write down each and everything on the point when I am with that patient. All right. And also, if I am seeing anything different, if I noticed any blister on the hand, any blister on the feet while I'm there, or if patient is eating breakfast, if they did not eat anything, I can document everything right there when I am there with that patient. And that's the way I do it. But if you feel like you don't want to be interrupted with other things, if you are doing medicine, you just want to focus on medications, so make sure you document all your medications for that patient, and then you go to the next patient, right? So most of the times what we do is we forget about documentation, which is not good. So in hospitals, in NHS, if you did not document, means you didn't do it. Anywhere else in the world it's same. If you didn't document, you did not do it. So make sure guys you document it. All right. In terms of complaint, the video I'm going to make today is about complaint. If a relative or attendant complain that you're not looking after their grandparents, what you can do about it. Here the patients, the relatives or the attendants, they know that NHS is very busy and the staff is short, the nurses are short, and we don't get enough people, enough staff to look after the number of residents, the number of patients here. So they know basically that it's very very busy. And what here the protocol for one patient is too much. I would say that we in the NHS, we are giving them 5-star hotel experience. Yes, you heard me right. It's very true, to be honest. It's very true. I mean, we in the NHS, we give them 3 times food, breakfast, lunch, dinner. We give them medications, we give them if they cannot wash themselves, we provide them bed baths, we take them to the toilet, we help them in eating and drinking. Also, if they cannot take shower by themselves, we take them to the shower, we do that for them. And if a patient is having any problem with the mental health or anything, we are there to support them. To be honest, the protocol is too much. They provide here in the NHS, they get toothbrush, toothpaste, shampoo, soap, conditioner, each and everything. Like, it's like a 5-star hotel. In my point of view, that's why NHS is very busy. Like, for one person they are giving that much protocol. And I mean, if the relatives, they come every day to see them, they can help us with anything. They can help us to wash the patient, or they can help us to feed the patient. So most of the relatives, they don't help us in those things. I mean, they come there, some of them. I'm a nurse. I'm here for the last 3 years, and sometimes I would see any relative or any family member who come there, wash their parents or wash their grandparents or help them in feed. It's very few people they do that. Very few people they do that. And most of them, they come to see the patients, but they don't help with anything. They don't do anything for the patient. That's not really good. I mean, we will do everything, but most of the times we don't get enough time, right? If I have 12 patients, I will try to do the priority things. I mean, I will rather give them the medication. I'll spend my time in giving them the medication than washing the patient, isn't it? So I have 12 patients and I will give them the medication. By the time I finish my medicines, it'll be already 3 hours. So what I'm trying to say is, if I get enough staff for the shift, I'll be able to manage it very very well. But if I don't get enough staff, I will struggle. I usually struggle, and then I prioritize my things. What are important things, I'll do them first. I'll do my medicines first. I will provide the oral hygienic care first, instead of washing the patient. If they are wet, obviously, then you will wash them. If they are soaking with poo, if they are soaked with the poo or with we, then obviously you will do that. But for the patient who just need a bed bath or shower, it can be skipped. So if family members can help us in that, that would be really really good, but most of them they don't. All right, so that's why NHS is busy, because we are giving them 5-star hotel service. And as a patient, if I think about it, as a patient, it's really good for the patients. I mean, family, they don't have to be worried about anything. They don't have to think about their food, their meals. They don't have to think about their stay in the hospital. Even at the end of their hospital stay, when we discharge the patient, we also book them taxi. We take them to home. We send them home. It's really really good for the patients. But I'm saying is, what I'm trying to say is, when the relatives they come, they can help us also in something something, maybe just to feed a patient, or just to feed their mom, or just to help them in reading newspaper, or read the story for them or something, just to give them mental support. Now let's come back to the point. The question Emma asked was, the relative complained about I'm not looking after their grandmom. You can tell that relative, I'm so sorry that you felt that, but when they're complaining, try to listen to the person, what are they saying, and try to get all the information that they want to tell you. Listen attentively, pay close attention, and find out why they're worried, what's their problem. And when you get an idea what is their problem, then you can try to find out whether it's true or not. So when the patient is complaining, it seems like a difficult patient handling a difficult situation. So try to listen attentively, ask them what's wrong, why they worried, why they concerned, what is their problem. I mean, why they are complaining like that. I mean, try to find out the root cause of that problem, right? If they are saying that I am not looking after their parents, you can also ask questions about why did you feel that I'm not looking after, what's wrong, why your grandparent, was she not washed, was she not given medicines, or was there anything wrong, anything went wrong or something like that. So you can ask, you as a nurse, you are trying to find out the problem, find out the root cause, and then find out the root cause, and then you can provide solution. Engage them in your engage them in the solution. I mean, ask them what can be done for this problem. If you feel like your mother was not washed, and what can we do in order to do it regularly. And this is I think it's not a good example. If the mother was not washed, maybe if they're complaining about medication, that my mom is not taking medication properly, or you are not giving them tablets properly. And if the patient is dementic, or has dementia or Alzheimer's, you can tell them that I gave them the medicines, I gave them the tablet, I gave her the tablet, but she didn't swallow, or she doesn't like to take it. She said she will take it later, or whatever the case may be. It's hard to answer like that. But in simple, if someone is complaining, if someone is complaining, you need to in simple, if someone is complaining, try to listen very attentively, provide solution, come up with new ideas, give them suggestion, and also include them in the nursing care plan. Ask them what can be done, what should we do, how does she do it at home. And I would suggest, please be very truthful. And if you give the tablet, try to if you given the tablet, patient didn't take it, tell that to the relative that I gave but she didn't take it. What we can do is also, if you can come tomorrow on the medication time, you can help the patient take the tablets in that time. Maybe with you she'll be able to swallow them properly. Patients with dementia or Alzheimer's, they work well when their relative is there, when their kids or their grandkids, grandchildren are there. They take tablets, they also go for shower, they also sit out in the chair. So try to involve them in their activities. Tell them that if you can come tomorrow this time, you can help your mom in eating, or in eating their lunch or dinner, whatever the case may be. So this is the way only. If complaining for complainant, you need to reassure them, tell them all the scenario that I'm sorry, but we are very busy, our hands are full, we try our best to do as much as we could. And this is if just be truthful and tell them that that what you did and what you couldn't do because of the pressure or workload, because it's obvious the people also, the relatives also, they know that it's very busy. And obviously in the NHS is free, and if they want to get a private home care or nursing home, they can do that also. You as a healthcare cannot give that option. Your nurse or your supervisor or your doctor give them that option, that in the private sectors, it's if you want to take your mom or your grandparent to a private sector, you could do that, you have the option available. But here in the NHS, obviously it's very very busy. We try our best, but if something is wrong, I'm so sorry for that, I apologize, but I will escalate it to my manager also, if we could get enough staff. And you can also help us in achieving this. And if you still want to make a complaint, you can go on pause, you can make the complaint. That's absolutely fine, you have the right to do that. And also the tenant, the relative they told you, tenant the relative they told you the story, you need to report it to your supervisor or your manager, that this has happened, and this patient's relative may complain, so they would know that. Also you need to document it in your notes, that the relative said this and this, and he was reassured, and what I said and what we did in order to resolve that complaint. And also you can mention in your notes that I have informed the nurse on duty, I have informed the nurse in charge, I have informed the manager about this situation, right? So in order to handle the complaint, you are just there, be your own advocate. Okay, try to explain then the situation, and also come up with the suggestion and ideas. Also report it to your manager and complete your documentation, that you did everything, and what you did, what was done, and what you escalated to your manager or not. All right, so that's it for today. I hope I answered this question properly. I'll see you soon in the next video. If you like this video, please give it a big thumbs up. You can also share it with your friends and colleagues. I'll see you soon in the next video. Till then, take care. Bye bye. God bless.